Intellijoint VIEW is a web-based preoperative planning and templating solution for total hip arthroplasty. Create a case and upload a scaled AP and a standing and seated lateral image using drag and drop or browsing local computer files. For templating, the AP standing image needs to be scaled using an object with a known diameter or length. Leg length discrepancy is measured using a reference line and symmetrical bilateral points. Use the teardrop line or interischial line for reference and the most superior or medial point of the lesser trochanters. Add a cup by selecting the vendor and system type. Place over the acetabulum and adjust for size. Select and place a desired femoral component and adjust for size. The predicted leg length and offset changes are shown in the top left. For the hip spine assessment, select the corresponding icon under each picture to assign images to each canvas. For lateral images, the patient must face left. Use the flip button if needed. Select Continue and follow the steps of the Auto Start wizard. A reference line is needed on the standing AP image so the inclination value can be projected accurately. To measure the anterior pelvic plane tilt, points need to be placed over the pubis and between the two ASIS. Sometimes both ASIS will be perfectly aligned, but there is usually pelvic rotation, so it's important to look for both and place the point between them. The sacral slope should be placed over the end plane of the sacrum. The tools at the bottom right can help with difficult visualizations by changing the zoom, brightness, and contrast, or by using the peak X-ray button so the lines temporarily disappear. Once the cups are placed, the patient-specific target zone visualizers appear. A green triangle indicates that the cup position falls within the target zone for that functional position. A red triangle indicates the cup position is outside of the target zone. In the graph on the left, the solid green rectangle is the ideal cup position in the standing position, and the overlapping dashed area reflects the optimal range of cup values in the seated position. The overlap is the target zone, and this would change based on the measured spinopelvic mobility. The dark circle represents the current cup position. When the auto balance cup toggle is selected, the cup position is changed to the center of the target zone. In this example, you can see there's not enough anteversion when the patient sits, putting them at risk of anterior impingement. This is then rectified when auto balanced. The Deliver tab allows the templating and hip spine plans to be integrated with Intellijoint Hip. Download, email, or display the QR code and scan into HIP. Then launch the OR display to show the plans and patient image.